Good morning, everyone. My name is Kiara, and I'll be presenting with my colleagues Kajal, Kelsey, and Adina. Today, we will be discussing how the COVID-19 health crisis has the potential to become an even greater threat, especially on college campuses, and our recommendations to help curb that threat. Our presentation is based off of a New York Times article, and our intended audience is universities who chose to have in-person instruction this year. As you saw on the previous slide, there is a potential risk for a twindemic with the upcoming flu season. What that means is that experts believe the current COVID public health crisis will overlap with the upcoming flu season and create an even greater threat. This problem is exacerbated with college-age students since only a small percentage get their flu shots each year. Because of this, to ensure public health on campuses is maintained, we believe that universities must increase education on flu shots as well as increase the number of opportunities students have to receive flu shots. Luckily, we believe that this is achievable since infrastructure was put in place to handle COVID-19, and our goal is to use that existing infrastructure to make flu shots more readily available. Additionally, we believe small incentives and community partnership will help to increase the percentage of students who go and get their flu shot.
With fall 2020 approaching and colder weather headed toward the northern hemisphere, there is concern over the twindemic of COVID-19 and the flu. So just some background on kind of how we arrived at our outcome is that it's understood that this colder weather could lead to higher prevalence of the flu and therefore harsher and more severe symptoms of COVID-19. Additionally, there is fear that due to COVID-19 distancing and fear to access healthcare facilities, people will be less inclined to get their flu vaccine. Since Australia has already experienced their colder climate and flu season this year, in addition to their flu season in conjunction with COVID-19, it's interesting for us to use them as a case study. For Australia, flu rates were down, and that's likely due to Australians being more compliant in social distancing, so they were less likely to spread not only COVID-19, but also the flu. Due to this fear of the twindemic, they also were more inclined to get vaccines. As Americans are not following these same social distancing guidelines and many are in close quarters, specifically at universities, we thought a university-centered push for flu vaccine would be a best practice to cut down on the possibility of the twindemic here in the United States. There is data showing that university students are fairly receptive to the concept of the vaccine, but less inclined to receive the vaccine themselves. There is the counterpoint that due to less interaction and in-person courses, flu spread could decrease, but that's why we are focused on American universities that are offering in-person courses. Here, students are still attending classes and living with each other on campus, so we think focusing our vaccination efforts there, it will aid in a reduction of the possibility of this twindemic. The California school systems have mandated all students and employees get the flu vaccine prior to coming to campus for the spring semester, as they are currently all remote. And we just think this is a really simple approach, as universities already have flu vaccination programs set up, as well as COVID testing sites and COVID communication.
Only 39% of students get the flu vaccine every year, and this is a huge concern, especially with COVID-19. After some research, we found that 36% of students believe that they're healthy and don't need it, and 31% believe it doesn't work. Additionally, 61% of students said that the likelihood of them getting the flu vaccine would increase if there was a monetary or other incentive, and 61% said they would be more likely to get it if it was provided at little or no cost. Lastly, individuals that have an influential role in decision-making are parents, family members, and the student health centers on campus. Going forward, data that would be helpful to know is how often students are required to get tested for COVID-19. By having this information, we can develop individualized strategies to increase vaccination rates.
Based on our data analysis, we created recommended solutions that were categorized into 3 different buckets. Those connected to our current COVID prevention efforts, those that rely on the maximization of current campus resources, and solutions that incorporate the community. The primary, secondary, and tertiary prevention measures to combat COVID-19 present an opportunity to avoid recreating the wheel in some areas of flu prevention. The current COVID testing sites have created an additional access point to receive the flu shot. When students go in to get tested for COVID, they can simply ask to get their flu shot at the same time. Additionally, many universities with continued in-person classes have created a virtual COVID screening process that students are required to fill out before attending any in-person sessions. It would be very easy to add an additional question asking students whether or not they have yet received their flu shot. If the answer is no, we can offer further resources on how to access a flu vaccine. Additionally, we can optimize our non-pharmaceutical measures that are already in place. This is a really important point because of COVID. Universities are already improving their hand washing and sanitizing presence on campus. They're requiring face coverings and they're practicing social distancing. All of these non-pharmaceutical measures will help decrease the spread of the flu this winter. Our next bucket is maximizing utilization of campus resources. So using our current healthcare infrastructure through student health, we can offer flu shots at every appointment. Again, when students come in for their appointment, they can simply get their flu shot at the same time as recommended by their provider. We recommend that our student health organization partners with other student organizations on campus to facilitate pop-up flu shot clinics. It is important to ensure that these pop-up clinics are in compliance with the CDC guidelines for COVID prevention and safety. The universities have a large database of parent and guardian information for their students. Knowing that there is a 48% increased chance of a student receiving a flu shot if they're influenced by their parent or family member, we believe it is important for universities to tap into that network by emailing families to remind their students to get a flu shot. Another big point that we think is important is providing education on the flu vaccine. There is an understanding that there is a misunderstanding on what the flu vaccine does and doesn't do. So making sure that students are educated on the pros and cons of a flu vaccine and the importance of receiving it is really important to stop the spread. Finally, we believe by exploring community partnerships, we can make this a community-wide effort around college campuses. This means partnering with pharmacies to create more access points for students to receive their vaccine is one way to do that. Another way is to partner with local stores and restaurants to generate incentives that pique students' interest in receiving vaccines. These could look like gift cards, restaurant deals for takeout or coffee shops, or tapping into our university resources for on-campus incentives. We believe this comprehensive approach will improve flu shot vaccination rates among college campuses, thus improving the health and safety of the students, employees, and communities surrounding the campus. This will aid in the fight to prevent a twindemic. With that, if you have any questions, please do not hesitate to reach out to our team.